Well, a very good evening to everyone. Welcome to Buddhist Jam Fellowship Jam Dhamma e-learning series. This current series is under the topic of psychology in Buddhism, where last Saturday, July 3rd, it was actually rolled out with the keynote sharing by our own Bhante Kumara on connecting Buddhism and modern psychotherapy. And this evening is the first of the 10 topics where 10 Buddhist mental health professionals are coming together to share with the community on 10 practical topics related to psychology in Buddhism. This whole initiative is organized by Buddhist Jam Fellowship in collaboration with Kuala Lumpur Buddhist Mental Health Association and supported by the Theravada Buddhist Council, Malaysia. I am very honored and privileged to have this opportunity to be the chairperson of this evening session. And the topic is Modern Buddhism Influence Psychotherapy by our very own special guest speaker, Dr. Tan Eng Kong. And please bear with me, audience. I have the formal and informal introduction to welcome our speaker for today. The formal part. Dr. Tan Eng Kong, he's a medical doctor, psychiatrist, and Buddhist psychotherapist who founded Metta Clinic, an established group psychological practice in Sydney, Australia. But Dr. Tan was from Malaysia, and he was founder president of Young Buddhist Association of Malaysia back in the 70s, and the president of the Buddhist Society of the University Malaya. Dr. Tan was even the novice monk under the tutelage of our late Venerable Dr. K. Sri Dhammananda at our Brickfields Vihara. However, Dr. Tan migrated to Australia in 1976, and he's the founder president of the Australian Association of Buddhist Counselors and Psychotherapists. And Dr. Tan also played an important role as an adjunct professor, lecturer, and academic board member of Nantian Institute, the first Buddhist tertiary education provider in Australia. In his work, Dr. Tan offers individual, couples therapy. He runs meditation, personal development therapy groups, and the last 45 years, he has presented seminars and workshops on Buddhism and psychotherapy in Australia and overseas. Now, the informal introduction from myself. Before the pandemic, Dr. Tan and his wife, Sister Sriha, they always travel back to Malaysia almost every year to visit family members, and Dr. Tan had offered many Dhamma talks to our Buddhist community. I am one of the privileged one again that has precious opportunity to learn from Dr. Tan and Sister Sriha whenever I manage to fetch them to BGF, when Dr. Tan is giving a talk there. And of course, we had many lunch and dinner sessions to catch up, and I have learned so much from both of them. So, with a heartfelt gratitude, I now invite Dr. Tan Eng Kong to share with us on today's topic, Modern Buddhism Influence Psychotherapy. So with this, over to you, Dr. Tan, for today's session.
Thank you, Mian. Thank you for your very generous and warm welcome. I feel I'm back in KL now with all of you. And thank you to BGF, one of your founder presidents, Benny Liao. And thank you to KL BMHA, which was founded by Pang Chengka and Mian and your whole team. Thank you for inviting me to sort of give an update on what are the contemporary Buddhist influence psychotherapies. I shall talk for about 45 minutes so that we have about 45 minutes for discussion, which I think is usually the better part of the whole presentation, some active discussions. So, first of all, just to set the scene and to clarify, in Australia and most parts of the world, therapy refers to a longer term work that has to do with thoughts, behaviors, feelings um, that have impacted on us in our work, in our life. And it's deeper than counseling because it seeks to uncover the root causes of problems. So often the results are quite dramatic, and there are definitely shifts in the way we think, we feel, and our personality grows and our personality changes for the better. Yeah. Counseling is very important because it's very useful in the short term to provide solutions to a very specific current problem that an individual may have. So sometimes I offer counseling. Most of the time, I offer therapy. Sometimes some members of the public will come to me for counseling, and some months and years later, after they've had relapses or further difficulties in life, they come for the longer term therapy. So there is a lot of overlap between Buddhism and psychotherapy. Both healing traditions, these are the 5 areas that we are so similar. Both believe that mind matters most. And as you all know from the Dhammapada, the first line, mind is the forerunner of all things. Yeah. And of course, psychotherapy being psychologically based, it all comes from the mind. There is great emphasis, correctly, I feel, on self responsibility. We can no longer blame others or blame circumstances and conditions, although they might be the triggers for our suffering. But ultimately, it is up to each of us, whether in our spiritual journey or in therapy, uh, to reduce our suffering and to help ourselves with the various skills and techniques that we learn from therapy. Where in the area of dealing with pain, pain is inevitable. It might be a good point for me now to say, uh, but suffering and the amount of suffering is optional. This is where Buddhism and therapy comes in a major way. Both tradition believes that pain is inevitable, yes, and both healing traditions, of course, with psychotherapy, it is to reduce the suffering, and Buddhism, of course, for the whole length of the spiritual journey towards enlightenment, is for the cessation of all suffering. They are both introspective endeavors. There is a lot of reflecting and a lot of self knowledge that is gained in the counseling therapy process. Whilst in Buddhism, meditating, practicing mindfulness all the time is the main introspective endeavor. And most Buddhists, and certainly recommended for most Buddhist psychotherapists, we would have at least half an hour of meditation per day accumulated through the day minimum, and at least once or twice a year to attend a short or medium term retreat. Both therapy and Buddhism, there are 2 persons involved. There's the patient and myself as the therapist. And in Buddhism, there's myself and all the ajahns and bantes and rinpoches that I learned from. Whilst there are differences in the details of the relationship, both healing traditions require a relationship between the 2 individuals. when the members of the Sangha come to attend the professional training course that we offer on Buddhism and psychotherapy, they learn about transference, countertransference in the relationships. When we attend talks by our Bhantes and Ajahns, we learn about the relationship between the originally the Buddha and his first 5 disciples, and now the relationship that is also encoded in the Sangha or the teaching of the Sangha. So, to continue from where Bhante Kumara was speaking on this beautiful presentation a few days ago, the differences between psychotherapy and Buddhism. Of course, psychotherapy is for the individual, whereas Buddhism is for all sentient beings. Psychotherapy has a very limited and humble aim. It is actually for the relief, or at least the reduction of symptoms, whilst Buddhism promises in the whole spiritual journey until we become a Sri Mantra and finally an Arahant for the cessation of all suffering. Of their successful therapy, the patient may look at me and say, okay, I'm quite well now. I don't have any symptoms. Now, what do I do about my life? So existential inquiries and spiritual inquiries can come up after the suffering has been much reduced. And here then, if they are a Buddhist, I'll encourage them to continue on their spiritual journey with the respective Bhantes to recommend. And if they are of a different religion, I respectively turn them to their priests and their spiritual leaders of their religious belief to continue those philosophical, spiritual questions. Therapy is self-knowledge, whilst Buddhism not only self-knowledge, but also expands to the whole theory of mind that the Buddha discovered in his continuous meditations sitting under the Bodhi tree, and ultimately is towards the truth of the human existence. Yeah. In therapy, we repair the damage or disintegrated parts of the self, and we develop further a stronger, healthy self, whilst Buddhism takes us beyond that from the concept of the self or the ego to the non-self of selflessness. I'll speak to this a little more later. So in therapy, it is a redistribution, if you like, of the psychic energies in the mind and the body, whilst Buddhism really takes us to our relationship beyond selves to the transcendental. So it's quite a different journey. It is quite important when someone comes for assistance to first of all point them whether is it in fact therapy that they require first, or is it the spiritual journey to commence with or to continue. And this itself requires discussion with the person who's come to the Sangha or to the therapist for assistance. So what are the strengths of each tradition? I would say that since the time of the Buddha, the Buddha's teachings were 2,600 years ago, the teachings started from Sigmund Freud. It's only about 250 years ago. Uh, from the time of Freud and the post-Freudians, we have a very detailed and somewhat exhaustive theory of personality that was not there in the past. Um, and it strives from sicknesses to normal, ordinary, good health, which, as Brother Kumara was also pointing out, it is just merely to help us to function, to be able to work, to play, and to love, to give and receive love in our relationships. And even Freud and the post-Freudians acknowledge that beyond that, whilst we are functioning well in life, there is still the common ordinary unhappiness. Psychologists also refer to that as a general feeling of dissatisfaction or a sense of lack, which only the spiritual journey can continue to assist. So in Buddhism, we are leading to the truths that the Buddha shared with us on human existence. As long as we're in samsara, we suffer. But from samsara, we are all hoping we're moving towards nirvana in our spiritual journey. And the path, of course, the Eightfold Path is to keep developing our mind, our ethical foundations, and our continued acquiring wisdom. So, in a sense, every teaching of the Buddha is useful in therapy because both healing traditions uses the mind to help the mind. What are some of the outstanding Buddhist teachings that, in my mind and in the mind of many psychologists, psychiatrists who've written on the similarities between the two healing traditions, which ones are similar to psychotherapy concepts? So, Paticca Samuppada, as most of you would know, is very complex, many layers of understanding. And I've just completed my third retreat on dependent origination with Ajahn Sujato and Akaliko in Sydney. And more I'm impressed that it is similar to the Western psychotherapy basic concept of cause and effect, whilst dependent origination takes it to its details. In terms of the Pali term Paccavekkhati, which is in the Four Foundations of Mindfulness, it refers to the applied continuous introspective reflection that is required in our deeper and deeper areas of meditation. And sure enough, Peter Fonagy, who is a researcher and therapist from the Attachment Theory Foundation in the world of psychotherapy, he refers to this in the studies between babies and mother, the interaction between the baby and the mother, as the self-reflexive function that we are all born with. Even the baby can self-reflect from its interactions with the mother that forms the early memory and learning that develops the sense of self and to become a person as the baby grows up. So it is wonderful that modern psychotherapy theory and practices actually supports some very basic understanding of the mind that the Buddha has been talking about 2,600 years ago. So we now know, and it's been confirmed scientifically, In the world of psychotherapy, the unconscious continues residue of emotionally charged memories from the past. And of course, Buddhism considers the mind as a dynamic continuum, the mind as consciousness, and it extends to many, many births. Another very deep teaching from Buddhism that is just beginning to be relevant and to be talked about in the world of psychoanalysis and psychotherapy is the not so easy to understand concept of anatta, non-self. Now, in in-depth long-term analytic psychotherapy, spiritual moments arise between my patients and myself. And the psychoanalyst Wilfred Bion, who spent a lot of his years in India, we can't help but suspect he was influenced by Buddhism in India, although he doesn't talk about it in his writings. He uses the symbol of O in terms of approaching transcendence in terms of O. The O is at one with the transcendental. And when such moments occur in deep psychotherapy, questions are raised that are better answered by the spiritual leaders of my patients, and I refer them on for their ongoing spiritual journey. So there have been many psychoanalysts from the past who have referred to such spiritual moments. So coming to the main thrust of today's talk, what's new? What's new from even the world of scientific research in psychology? Affective neuroscience. Affective means emotions. And it's as recent as 1990. The further investigation of feelings, we now have theories in psychotherapy that we've changed from Freud's original drive theory, the drives from the basic id to the ego. We now realize that what motivates us and what changes us is much more affect driven, much more due to our emotions. Thanks to Elizabeth Gold, and this is only 30 years ago, neuroplasticity. So much study now on neuroplasticity. You know, when I was a medical student, I was told when you are born, you've got so many brain cells, and from there on, the brain cells begin to die, and dementia is reached in our old age when we have many dead brain cells. We now know not only there is growth of new brain cells, although not many, but each brain cell and each brain cell's connections to the next brain cell, the dendrites, actually increases in neuroplasticity. So we now know that the brain can change itself. There is a book by Sharon Beckley in this area entitled Train the Mind, Change the Brain. And Sharon Beckley is a journalist who took her experiences listening to the Dalai Lama and in the Mind Life Institute series with the scientists, more and more investigations showing that positive relational experiences enhances the possibility of growth of the dendrites and neurons in the brain, enhancing growth and change. Eric Kandel won his Nobel Prize on research in memory and learning systems, and we now know it is experience dependent. And for us Buddhists, we realize that the more we meditate, our memory and our capacity to learn increases. Since the post Vietnam War, and a lot of studies from trauma, from childhood abuse, we realize um, that from developmental psychology, how the brain is physically traumatized due to psychological traumas as well, and how we have developed a whole new area of therapies for trauma. Since Gali's discovery of mirror neurons, we now can explain how is it we can learn a lot um, even without language. The non-verbal communication, even from our faces, the expressions of our emotions to our faces is picked up and through the mirror neurons, and we learn, we change because we're able to sense even the unspoken from another. And finally, but most importantly, research on the body, which has led to EMDR, yoga, polyvagal theory, and so many other theories, which are now in applied psychotherapy. It confirms what the Buddha has said um, so many years ago with regards, if I get back the old slide, sorry about that. The word chitta from the Pali language, chitta is body and mind. But now modern research have actually concluded that the body is the mind, and when we have therapies affecting the body, like yoga, like EMDR, it can actually change and improve the mind. So, a little more detail in this area that is new, that confirms, thanks to the Dalai Lama's Mind Life Institute research as well, which has affected the research in neuroscientists like Pang Sep and Damasio as well. We now know that there are these 7 basic emotions. We have seeking behavior because we are interested and we want to be engaged with others and engaged in the world. Um, Lust here meaning the normal, ordinary sexual appetite, not the too much lust that Buddhism talks about. Uh, Care. We now realize that it's not only the mothers, but fathers too are born with the basic instincts to care for their offspring. Joy, and now uh, modern psychotherapy, including what is now known as positive psychotherapy. Positive psychotherapy has come um, from the study of happiness, how to increase the happiness index. And it now confirms the Buddhist teachings on mudita, appreciative joy. Yeah? And I'm very glad that, in fact, um, Dr. Ong Tian Kwan will be speaking on kindness. And Dr. Elvin Ng will be speaking on appreciative joy in this series of 10 talks. In terms of anger, Sister Tang Mi Yuan will be speaking on anger and jealousy. And anger is a very important basic emotion. And anxiety, of course, which leads to us running away or freezing. And for all the various mindfulness-based therapies for anxiety. In terms of sadness, which can lead to a clinical syndrome of depression, is when our relatedness needs are disrupted. And we now have scientific evidence for a lot of our therapies and for a lot of our meditations. Um, I work particularly in dynamic analytic therapy, and it actually follows in the time of the Buddha, the Indian medicine already had symptom, cause, prognosis, and treatment. And that's the first noble truth, the symptom, there is suffering. The second noble truth is the cause, tanha. And the prognosis is very good, according to the Buddha. There can be the complete cessation of suffering. And the treatment is the Eightfold Path, which is the fourth noble truth. Yeah. And of course, the Eightfold Path, wisdom has even been scientifically researched now. Just recently, I gave a talk on the scientific basis of wisdom, and now there is even a wisdom index that you can score yourself. You can Google the wisdom scale by Jess Dilly, and we understand that it comes from the Buddhist tradition, it comes from right intentions and right views. For mental development, of course, Western psychotherapy has appropriated mindfulness from Buddhist teachings for the mental development of our patients. And it's also contributed to the moral development through our speech, our actions, and our livelihood. So, the basic underlying human suffering in Buddhism, because we're in samsara, if we just use one word, it is tanha. In dynamic therapy, from the days of Freud, we thought that we're born with these primitive id impulses, uh, quite a number of which are quite destructive and quite aggressive. But we now move more towards the basic emotions that are problematic. And if again we need one word, it is again the tanha from dependent origination. And it moves from wanting something to desiring something to not only desiring, then we grasp it. And the real problem is we cling on to it, we can't let go. And a lot of therapies nowadays joins the Buddhist belief that it is about letting go, letting go, letting go. Even in the treatment of personality disorders, uh, fundamentally the personality get disordered when we are over invested in the I, the me, and the mind. And the spiritual journey also helps us to let go, clinging on to this egoistic self to move on to the transcendent. All the aspects of mindfulness are now used in mindfulness-based therapies. As we remember, the Satipatthana Sutta, Satipatthana meaning remembering this present moment, and it's a basic foundation for the mind, for us to use, to attend to the mind. Mindfulness of the body, in particular the body scan technique that Western psychotherapists and all of us use as psychotherapists. We now know that even in complex post-traumatic stress disorder, it is the body that keeps the memory of the pain. And now, for instance, another Buddhist-oriented psychotherapy called the Hakomi method. Hakomi uses the body to access the painful memories from the past and to deal with them mindfully. Yeah, mindfulness of the feeling tones, and for us to be able to track pleasant, unpleasant, or neutral emotions non-judgmentally. There we are, chitta, which is the body mind, to discern our inner mental states, uh, which again are caused by craving, uh, by aversion, and or by delusion, mainly the ignorance from the dependent origination. So even in the retreats we attend to deepen our Dhamma studies, when we practice mindfulness of the Dhamma itself, all these factors not only relieves us a lot of suffering, uh, it leads us ultimately to enlightenment. So, in the whole area of CBT, and there are many of us in the audience today who are psychologists, specialize in cognitive behavior therapies. We all got started by John Kabat-Zinn on mindfulness-based stress reduction, the 8-week program. And from the template of the 8-week program, there are so many other mindfulness-based therapies now. One of the first to be developed was in the area of depression. And in the area of depression, we now know mindfulness-based cognitive depression can reduce the relapse rate of depression by 2/3. And most of my patients hearing that wants to benefit from mindfulness-based cognitive therapy. Yeah? Acceptance and cognitive therapy, first formulated by Stephen Hayes, it actually brings in the Buddhist moral development, in terms of the value system of the individual. Yeah? And of course, compassion-focused therapy. And we have with us Sister Mian, who's taken the trouble to attend and now to teach and practice compassion-focused therapy. Um, Originally, one of them was the Mindful Self-Compassion course by Chris Germer and Christine Neff from overseas. And now it's available in Kuala Lumpur, thanks to Mian and her whole team. And it's also available in Australia and all over the world. I do see couples with marital problems, and there are structured mindfulness-based couples therapy available today, using mindfulness as the main tool to help the couple. So, in terms of the Brahma Viharas, in terms of loving kindness, I'm very glad to remind all of us that Dr. Ong Tian Kwan will be presenting on how to cultivate friendliness and kindness in this series, which is an antidote to ill will and hate. In terms of compassion again, uh, Sister Mian will be speaking. And as we all know, is the antidote to cruelty, and antidote, a very powerful antidote to our destructive emotions. Appreciative joy, that we can develop positivity, we can turn towards gladness, towards gratitude, and it's a very powerful antidote to depression and to negative emotions. And we have Dr. Elvin Ang, who will be speaking to us in this series on appreciative joy, gratitude, and contentment. Um, and there are books written on each of these Brahma Viharas. There is only one book written on appreciative joy by James Barras called Awakening Joy. There is no one single book written on equanimity. And just before the start of this talk, I was chit-chatting with Dr. Pang Chinka, and Chinka and I are wondering whether we should put pen to paper and write a book on equanimity. that brings in therapy and Buddhism in the one book, because we realize more and more our patients benefit enormously when their sense of balance, their resilience improves, meditating to cultivate some more equanimity, and is certainly the most powerful antidote in today's world, the chaos of the world and the chaos of all our communities and our interpersonal relationships. And it's even more pronounced in these pandemic times. Yeah. So, appreciative joy, compassion, joy, equanimity. So there are many therapies that have integrated Buddhism with psychology. Maura and Franklin Sills from the south of London uh, can look up call process psychotherapy even through Google. And there are several psychologists in Sydney who are practicing and teaching call process psychotherapy. Um, Dialectical behavior therapy from Marshall Linehan, in particular for borderline personality disorders. Um, Marjorie Schumann from America has just released a book on mindfulness informed, and the latest analytic model is the relational model. And it's very similar to the way I practice in meditative psychotherapy. 45 minutes over already. Yeah. Okay. So I will complete this talk by mentioning a little bit more on how I practice in meditative psychotherapy. So when myself as a Buddhist psychotherapist uh, and the client, the patient, are already meditators and we have some spiritual sense and we are both psychologically minded. In the middle phase of therapy, with each session, the patient and myself start with a 5-minute meditation. And at the end of the session, I actually ask the patient, is there any general meditation or any specific meditation? And in terms of specific meditation, any one of the 4 Brahma Viharas shall we meditate on now to cultivate and to integrate whatever we have brought up in this session for the benefit, for our benefit. So in the Therapeutic Alliance, the patient and I are in co-mindfulness to work through underlying deficits and conflicts in this way. So I hope this slide will generate some discussion and questions from yourself. Who comes for what kind of help and by whom? In terms of mild suffering, when it's our first episode, reacting to circumstances and conditions with anxiety or depression, the individual will self-refer when they have sufficient interpersonal difficulties. And in terms of mild suffering, the Sangha members and the mental health professionals can help equally well. When we move on to moderate suffering, in terms of symptoms, the neuroses and the personality disorders, by the time they affect the livelihood of self and others, and in the private life as well, they're mainly helped by mental health professionals, and it is through CBT and or dynamic therapies. And sometimes medications are required at a very small dose for a short period of time. But when it comes to severe suffering, so we are in the psychotic range of illnesses like schizophrenia, bipolar disorders, borderline personality disorders, and so on, We actually need treatment and a management team by psychiatrists, psychologists, and we use medications as well. Yeah. And in the end, it is not the particular techniques of therapy, but a deep relationship conducted with awareness and compassion that in itself is the source of healing. And when I was a student in high school, I read this book by Jack Confield, um, A Path with Heart. This is one of the latest editions in 1993. And Jack was a leading, still is a leading psychologist who combined Buddhist teachings in the way he practices. So thank you to Jack Confield and all the psychiatrists and psychologists who have helped me integrate Buddhism with therapy. Thank you all. These are my offerings to you, and I now look forward to your comments and your questions and discussions. Thank you.
Thank you. Thank you, Dr. Tan, for such a deep and enlightening sharing with all of us. And brothers and sisters in the Dhamma, yeah, our most respected Bhante Kumara have actually joined us in this session. So let us all, before we proceed to the Q&A session, put our palms together and pay our respect to Bhante Kumara. Let's do that together. Good morning, Bhante Kumara. Thank you for joining us.
Hi,
Hello.
morning.
Morning. So, Bhante Kumara, do you have the first question for Dr. Tan? As I'm opening up the Q&A segment for the whole audience.
No, actually.
No, okay. Then we'll invite other brothers and sisters to ask questions.
I have something to say to Brother Kumara. Yeah. Thank you for joining us, Bhante Kumara. I so enjoyed your talk the other day.
Oh, really?
Thank you for paving the way for this talk. And I referred to some of what you said in my talk earlier. And I'm so glad that you're here with us to contribute to this part of the talk as well. Thank you, Bhante.
Welcome.
Okay, brothers and sisters, over to you guys. So please seize this opportunity to ask our Dr. Tan as many questions as you wish to, yeah, for this segment. Go ahead, anyone. You can, I suggest that unmute your mic, and ask directly so that it's more interactive. Usually Malaysian audience need a little bit of warm up. So anyone want to start warming up with the first question?
Dr. Tan, I will start off.
Hello, Yvonne.
Hi, Dr. Tan. I'm curious. What have you experienced with patients who might be very strong in a different faith? How do you actually handle or manage the treatment or the therapy with them?
Thank you, Yvonne. In Sydney, Australia, most of my patients are Christians. Yeah. So what you say, your question gives me an opportunity to say, for Christians and other individuals of different religions, I use the word mindfulness. I don't use the word Buddhism, nor do I refer to the Buddha. Mindfulness, thanks to John Kabat-Zinn, 30 years ago, is now a secular word. And mindfulness is very well accepted by everyone in the therapeutic world. So I talk about, would you like to join my mindfulness training group? Shall we practice mindfulness together, mindfulness meditations, and shall we benefit from the various mindfulness trainings that can help your condition, and is very well accepted. Some of them will then reach a certain stage that they will ask, where does this mindfulness originally comes from? Then it gives me an opportunity to say, well, actually, it was there even before the days of the Buddha. Yeah. So mindfulness as a concept, as a training, was more than 2,600 years ago. So I say it comes from Buddhism in particular, but from the spiritual traditions. And today, mindfulness, which is very similar to contemplations, yeah, for the Catholics, Father Lawrence Freeman has brought back contemplations, meditations to Catholics in a therapeutic way. Yeah, and I encourage Christians to Google Lawrence Freeman, Brother Lawrence Freeman, and to learn Christian contemplations that are helpful. Very similarly, yeah. There is also the Book of Joy that I recommend. And the Book of Joy is actually a compilation of chapters written by journalists when the Dalai Lama invited, what's his name, the Catholic priest, for his 80th birthday, which was 6 years ago. And they had very delightful conversations with each other. His name will come to me in a while, or one of you might tell me his name. And together, the Dalai Lama and this very well-known Catholic leader, the journalist asked the question, how come the two of you have suffered so much in your life? How come the two of you are so happy and you can joke with each other? And it resulted in the Book of Joy. And they put together the 9 factors that contributes to joy from Catholicism and Buddhism, and it's in the Book of Joy. Yeah.
Is he an African?
Yes.
Desmond Tutu?
Yes, Desmond Tutu. Thank you. Desmond Tutu and HDL, the Dalai Lama. Yeah.
Thank you,
Okay.
Dr. Tan, I've something to say. I've just recently had a conversation with a Dutch clinical psychologist, and she said over there, therapists who will vow never to get involved with mindfulness because no, that's not what we do. But apparently it's different in Australia, but in Netherlands it's different. They know where it came from, and they're not going to touch it. Not too bad.
I think different people and different patient populations will take their time in absorbing what is relatively new. Yeah. So there are many more people gradually appreciating mindfulness, because mindfulness actually comes from all the spiritual traditions. Although Buddhism may be considered the first religion because of John Kabat-Zinn and others, to appropriate the central, because mindfulness is the central concept in Buddhism that is of practical use to the man on the street. Yeah.
Mm-hmm. It's quite necessary, actually, even in I think in all therapies, even when it comes to schema therapy, that is thought of as not having the mindfulness component. But if you look into it, it talks about observing yourself and being able to step back from yourself, to see yourself separately. It's there. It seems it has to be there in order to have a complete picture of therapy.
Absolutely.
Yes. Thank you. Thank you, Dr. Tan. Thank you, Bhante Kumara. And of course, Sister Yvonne, who asked the question, who sparked off this interesting discussion. So, Dr. Tan, we do have question coming in the chat box. I will read out to you.
Okay.
There's a question from Dr. Ong asking about dynamic therapy that you have mentioned. And Dr. Ong would like you to elaborate on this dynamic therapy.
Thank you, Dr. Ong. Dynamic simply means the psychological forces between individuals. Yeah. So in terms of dynamic therapy, is the thinking, feeling between the patient and myself. So what it brings up, and as I've said in an earlier slide, when both of us are in a state of co-mindfulness, and I'm using mindfulness in a secular sense here, the patient in the therapeutic alliance with me will be more and more able to share with me the developmental origins, yeah, of their suffering. So primarily the deficits and conflicts from their first 6 to 12 years of life, yeah, usually with the caregivers, the parental figures, yeah, which in other dynamic therapies that are not necessarily analytic moves on to, for example, in family therapy, systems dynamic therapy moves on to how the family affects the relationships and the family affects the individual in the development of, to use another word that Bhante Kumara has used, the schemas in the mind of the individual. Yeah. So that is dynamic therapy. It is the most popular form of therapy when the suffering, the symptoms are in the moderate and certainly in the severe range. Yeah. But because it takes a longer time, but it's not necessary for ordinary day-to-day reactive anxieties or depressions. Yeah.
Thank you, Dr. Ong, for the question and Dr. Tan for the response. So, okay, Dr. Ong maybe not convenient to on the mic. So I think Dr. Ong asked or reflected again, Dr. Tan, are you also referring to attachment theory in relation to your explanation on dynamic therapy?
Yes, I am. Attachment theory came later. Attachment theory focuses on how in the animal kingdom, and now including human beings, the human baby attaches itself. And we're now using the word attachment very differently from Buddhism using the word attachment. Okay, that's different. That's clinging. This is healthy, normal, necessary attachment, the baby to the mother. And from attachment theory, we now have a whole body of knowledge to understand that is actually basic for survival. In the animal kingdom, the baby ducks will follow the mother duck all in a row because it is the best way to be protected from the eagles that might come and snatch it for food. Yeah. Now, the same way the human baby is born with the instinct to be attached, to be close to the mother for its survival. Now, beyond survival, also for its relationship needs. Yeah, the need for the whole range of positive emotions. And from in a sense, a Buddhist point of view, which is also in Western psychology, the need to be loved, the need to be affectionately treated, yeah, to have that emotional intimacy with another, beyond survival. And it is only then that the baby can grow in its mind development. Post Second World War, there were babies who couldn't thrive, despite the fact the busy nurses just put a bottle of milk into their mouth and moved on. They actually died. They could suck the milk a little bit, but the milk never got digested because the holding from the nurse, the holding from the mother figure was, was not there. Yeah. So that is the basis of attachment theory. So attachment theory contributed in a huge way to the dynamic between the infant and the mother, and it is now taken to the dynamic between the child self of the adult patient to the therapist as a mother figure, as a caring figure to the patient. So thank you very much, Dr. Ong, for your question.
Dr. Tan, actually, the one asking the question is Sister Mi Yuan, Dr. Ong's wife, and Sister Mi Yuan is using Dr. Ong's Zoom ID to log in. Yeah, so that was our Sister Mi Yuan.
Yeah, and Mi Yuan, I'm looking forward to your talk on how to overcome anger and jealousy. Thank you, Mi Yuan.
Thank you, thank you. So yeah, we have another participant. Russell Gunn has raised his hand. So Russell, please go ahead and ask Dr. Tan the question.
Hi, good morning, everyone. Good morning, Bhante. May I know what is the difference between metta and karuna? Because to me, it seems quite similar, the concept.
Yes, it is. You're absolutely right, Russell. From the teachings of the Buddha, and also from psychological research, one leads to the other, and they are interrelated. Yeah? When we are basically a loving and kind person, we are also naturally compassionate. So both metta and karuna, both loving kindness and compassion, has to do with the range of positive feelings to help each other, right? But where compassion is different, compassion focuses on reducing the suffering of the other. Yeah? So you can reduce the suffering of the other by being kind, by being loving towards them. And you can also reduce their suffering, of course, by being compassionate towards them. Yeah. So thank you for bringing up this detail to distinguish the two. So it is not surprising that most of us in our spiritual journey, we practice more and more loving kindness meditation as a basis first, yeah, and then we move on to cultivating compassion, and with the help of psychologists like Mi Yuan, in particular, self-compassion. For all the four, whether it's loving kindness or compassion, to give it to ourselves first. And this is the other major contribution to Buddhism that is just so good. You know, we're very good at being compassionate to others. Most Buddhists are. And I'm sure all of us on this screen, we're all very compassionate people. Otherwise, we wouldn't be even attending talks like this, right? But what we all lack, funny enough, is to be compassionate towards ourselves. And self-compassion, all my patients find so helpful because all my patients suffer, and they suffer because of a lot of negative attitudes towards themselves instead of a compassionate attitude towards self. Yeah. So thank you, Russell.
Thank you, Russell, and thank you, Dr. Tan. And if I may add in some statistic, since Russell asked this question, Dr. Christine Neff and Dr. Marissa Knox, and this data is actually pretty new, 2016, yeah? And they actually found that 76% of all of us are very compassionate to other people, but we forgot to include ourselves in that circle of compassion. Only 16% of us are pretty balanced, compassion to others and compassion to self. And unfortunately, 6% of the people are so-called compassionate only to themselves, which is not so healthy. So it is very obvious, like you see, Dr. Tan, all of us, the 76% of us, are very caring, loving, compassionate people. And this is tricky because we may get tired, fatigued, and burnout, yeah, as we actually care and support and help other people if we forgot to recharge ourselves. So that's why I'm so passionate about Christine Neff's work in this area of self-compassion, because the 76% really, need to shift towards more of the 16%, yeah, in terms of really caring for ourselves and, of course, caring for other people. Yeah, so that's what I want to add it, into the discussion from Russell's question. And Dr. Tan, I would like to go back, yeah, because actually Bhante has actually asked you a question following, Sister Tang Mian's question just now. So Bhante actually asked, holding is for the nurturance part?
Absolutely. And thank you, Bhante, again. Holding comes from mainly Donald Winnicott, who's a psychoanalyst. He uses the word holding in terms of the therapist, the analyst, providing a holding, facilitating environment for the patient, for the client. And Donald Winnicott was a pediatrician before becoming a psychoanalyst. And he had seen more than 1,000 children and their mothers in his room as a pediatrician. And I must also take this opportunity to say hello to my good friend, my medical colleague, Dr. Koo Boon Hock, who is with us today. And Dr. Koo is a leading pediatrician in Malaysia. Yeah. And I'm sure Dr. Koo will know of Donald Winnicott. Winnicott used the word holding both in the physical and psychological sense. And definitely, yeah, I hope to some extent, we're all holding each other in this Zoom space. Yeah, we're all taking care of each other in this Zoom space. Whilst when our loved ones, we have opportunities to physically hug them, to physically hold them regularly. Yeah. And yes, it is not a luxury. It's actually been researched that it's an essential. Holding is for nurturance, and nurturance gives rise to growth, or in Buddhist terms, mental development. Thank you, Bhante Kumara.
Thank you, Bhante. Dr. Koo, go ahead. Yes.
Yes.
Good
Good morning, and really nice to see you, and thank you for the wonderful talk. I have a few questions. First is that, as a pediatrician, I've been seeing many children in this country, having this anxiety, depression, and worst of all, self-cutting.
They are.
And yes, we look at our Malaysian
You have
statistics
to be
of
aware.
mental health survey, we find that almost 40% of our children have anxiety problem, and 30% have depression. And that's this self-injury, about planning suicide, about 10%. Thinking about suicide 10%, attempting suicide about 8%, to me is a very, very serious problem in this country among our young population. And the age that this occur most frequently from the mental health survey a few years ago was 13 years old. And you can see from statistics now during this pandemic, the one that kill themselves the most in suicide is from 15 to 18, 19 years old. We have been seeing and counseling a lot of children with this problem. And thank you for your theory, because we do counsel them, but we don't have the psychological words that you use about dynamic therapy. In fact, what we find that I think this attachment theory is very, very important, and we must stress to our parents, especially I see a lot of Dhamma school teachers there, that very important for parents, as you mentioned, in the first, especially first 3-4 years of their life, to have this very close attachment. That means they must be a caregiver who is so responsive that the child must be seen as important, must have safety, must be soothed when they are hungry or upset, and they must have this sense of security. I think a lot of these children, which we see, about 35% have what we call insecure attachment, because they do not have secure attachment. And especially now with this pandemic, we have been seeing epidemic of online gaming and become addicted. And I tell you, to me, seeing children with online addiction is really a cry for parents and for us too, because there's nothing much we can do. My question come back to is that, Rob, you see, in this country, sometimes I do not know where to refer these children to. The mild ones, I know will take care. You know, even sometimes the problem is that I find, with no offense, man, but psychiatrists in this country has no time to talk to the patient, as you mentioned. You need to talk. A lot of times it's easier to just prescribe medicine. And once they are on medicine, I find very hard to go. So it's sometimes sad to say that it becomes more of a business now. Medical profession. You and me are the old schools in Kong. We are very fortunate we are from the old schools, you know. So my question is that, is there any way we can, you know, when we counsel these children, what do you do? Second question is coming to the question of mindfulness practice. I totally disagree that certain countries, just because certain psychologists or psychotherapists doesn't believe in mindfulness, I think it's just that person's opinion and perspective. And I think mindfulness has tremendous role to play. And is there any way we can teach children mindfulness practice when they are young, so that this, to a certain extent, and to teach them methods to prevent them from getting into depression, anxiety. Thank you.
Thank you, Dr. Koo, for sharing with us from your many years of practice as a very caring pediatrician. Yeah? And I concur with everything you said. And if it's any consolation, it is the same situation in Australia as well. We don't have enough, even amongst the psychiatrists, we don't have enough child, adolescent, and family psychiatrists. Yeah. And I'm just as guilty. I've specialized in adult psychiatry. But the numbers are growing. And you'll be delighted to know, Bunok, that even in Australia, but certainly in America and the United Kingdom, mother-infant psychotherapy is the leading age of all therapies in the Western world today. Yeah. So I have colleagues, and it's not surprising, most of them are females, qualified consultant psychiatrists who specialize in psychotherapy and then do extra courses and specialize in infant, child, and mother psychotherapy. So the mother and the infant or the child comes together into the consultation room. And that psychiatrist actually helps by modeling, yeah, without giving any lecture, actually by her behavior, including how she holds, how she comforts the child or the baby, yeah? Even beyond words, like using lullabies or using certain sounds to comfort the child, in addition to the skin to skin contact, the holding that is necessary. And the mother learns consciously and unconsciously from the behavior of that infant mother therapist. Yeah. So that's the good news. And more and more so. I must say I've had the good fortune to meet very good psychiatrists like Dr. Pang Chingka and others in Kuala Lumpur, who, whilst they are in adult psychiatry most of the time, they are aware of what you and I are talking about, Bunhok. And I'm sure uh, they will be very supportive of the push for more and more care for the younger and younger population. Yeah? So in terms of that, Australia, for a long while, Japan had the highest incidence of teenage suicides. And then in more recent years, Australia had the highest rate of teenage suicides. I don't know which country is taking the lead now, but it does emphasize what you're saying, because the sooner we attend to these problems, the earlier the age, uh, the more we can prevent problems in later life. So thank you, Dr. Kuhn, for bringing this up. And I hope I've answered your question in a somewhat indirect way. Yeah.
Thank you, Dr. Koo, for asking the question and Dr. Tan for answering. So there are a few people who raised hand. The first one I saw from very early was Sister Barbara Yen. Sister Barbara, do you want to add on anything, or is it a different question from what Dr. Koo has asked? Sister Barbara, go ahead.
Yes. Thank you very much, Dr. Tan, for your really enlightening talk. May I ask if about your new therapies for trauma, which is very new, and you mentioned that there was a sense of unspoken from one person to the other, the therapist to the person in need. I find that this is very, very real in our practice without realizing it. Because sometimes, even in one or two sessions, you can see that the client has really changed a lot and improved a lot. And a feedback is usually from the parent or from another person who accompanied them. And they say, in fact, one of them who is a doctor, both parents are specialists, and the mom told me that night after I saw the girl, the teenage girl, said, I think I owe you a treat. Then I was thinking, usually when after seeing my clients, they will say, oh, okay, thank you. And then one day we'll go for lunch. But this is what, like, I didn't even take note of it until weeks later. She said, the daughter shows signs of great improvements, especially she had crying spells throughout her life. The Form 5 girl, in fact, every exam she'll cry and she'll cry. And she said when she came back, She was very cheerful, and she went through her Form 5 exam, which was about 2 months away before I met her, with flying colours. She got a scholarship to do her course overseas, and she's doing well. So I was wondering whether this sense of unspoken, because I didn't speak to her very much, I just listened, because the first session, you just don't talk, you just find out what is really the matter. And she came up with many things that even affected her childhood, that she was keeping it for a while, for all these years, without sharing with her medically trained professional, parents. So when it came out and I did some art therapy with her, she just drew, subsequently in 2 or 3 sessions later, she drew things that really affected her, and see the improvement in these emotions as she worked on this therapy. So is there any thing that you can teach us about this new therapy in trauma that we can add on to our work? Thank you, Mr. Tan.
Thank you, Barbara. So lovely to meet you on Zoom. We haven't seen each other in person for so many years now.
Yes,
So lovely to see you, Barbara.
yes.
And thank you for bringing up and emphasizing what is known as pre-verbal development. Yeah, and you're absolutely right. A lot of very effective therapy happens beyond words. Yeah, and even Jack Confield and others have said, whilst there are so many skills and techniques that we need to learn and practice and help our patients, it is the ineffable, is the way we are in terms of our loving kindness and our compassion that helps our clients most deeply. Yeah. And this is where Buddhism takes the lead, of course. Yeah. So I fully endorse your emphasis on the pre-verbal. Yeah. And now it is not just a grandmother's version of help. It's actually scientifically researched in the area of trauma, which you brought up, Barbara. When babies and 1-year-old, 2-year-olds, 3-year-olds have been traumatized, whether it's physical, whether it's emotional abuse, they might forget in their early childhood and teenage and young adulthood. But in their adulthood, when they form relationships, they get married, and much more so when they themselves begin to have children, their children reminds them of what happened to them when they were a child, and they begin to develop symptoms. Yeah. And I even had a mother who came to see me because she developed severe panic attacks for the first time, watching her daughter step out of a taxi to go into the private school. And her memories as a child in primary school, being abused by a taxi driver, came back. Yeah. Yeah. Now, and there are many, many clinical examples like this, going right back to pre-verbal, before the age of 8. Yeah. Now, this is where memory and learning comes in, as in my earlier slide, pointing out that we now know, thanks to Damasio and others, our memory, especially our implicit memory, is encoded in our early years. And they are stored. And we actually learn from the implicit memory. For example, in the face of trauma, we learn to distrust. Yeah, we learn to distrust caregivers. So a lot of couples in therapy, I see, one or both of Mr. and Mrs. Smith, the marriage is not going well because there's a basic distrust between the two human beings at a very deep level. And it's not surprising that therapists and counselors learn that the first order of therapy is safety. The client has to first feel safe with us, safe in the consultation room. After safety is established, and sometimes that takes months, sometimes even years, that very deep trust that goes beyond because your reputation is so good, they come and see you. But it is the basic trust between one human being and another at a very deep level. When that trust is developed, then we can get into the area of whatever else happening, including words and sentences that can help. Another area of research that has confirmed what you're bringing up, Barbara, which is very exciting, is that we now know the intergenerational transmission of trauma. For example, there are lots of studies in Jews from the grandparents who suffered Auschwitz to the parents who now have children. So the grandchildren of the Holocaust trauma, the grandchildren whose parents did not go through the Holocaust, the grandchildren are having symptoms like the grandparents. Now, how is that possible? Now we know it even goes through the genes. The genetic material carries the trauma to the next generation and to the next generation. Now, in my mind, this confirms the Buddhist concept of karma. So we often refer to our genes as our karmic seeds. But now it is scientifically proven. So I'm so glad you brought this up, Barbara. Yeah. And the importance of the non-verbal. We've been communicating with each other on this Zoom through words and sentences. But 2/3 of our communication is actually non-verbal. For example, are we relating with each other? Or are we just making noise and just receiving noise from each other in terms of words and sentences? So 2/3 of our communication with each other now, even on screen, especially those of us who's showing our face and our parts of our body, yeah, it's not so much verbal, it's our non-verbal communication, our facial expressions, the way we move our body. Yeah, this has been studied in detail through neuro-linguistic programming as well. That is actually affecting how we're affecting each other right now. And it is actually beyond words. Although, yeah, we call it a talking cure, talking therapy. Actually, I wish Sigmund Freud had said from the very beginning, is actually a listening therapy. How well I listen to you, especially what you might be conveying to me non-verbally, and then how I respond verbally and non-verbally. That's where the medicine lies. That's where the action is, so to speak. Yeah. So thank you very much, Barbara, for bringing it up. I'd like to point out that Dr. T, who is with us, Dr. T. B. Chin, is a child psychiatrist and is the vice president of the Buddhist Mental Health Association you have in Kuala Lumpur. I'd like to invite Bichin, if you could, contribute to the discussion that Dr. Kubun Hock, pediatrician, had brought up. If it is not too late, Bichin.
Hi, Dr. Tan.
Hello, Bijin.
Sorry, it's a bit disturbance here.
That's
Yeah.
very good. Your child is very attached to you. Hello. 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 How are you? Yeah, so good. Yeah, with mommy, yeah? Yeah.
Yeah.
Yes, Bijin.
Yes.
I am good, very good at basketball.
Sorry, Dr. Tan.
Don't worry. Yeah.
Okay. Yeah, I do see a lot of children, especially teenagers now, even young children with the addiction in the gaming and internet, social media, even girls with the shopping also, shopping spree through the net. Yeah. So I think if you look at the reason of them indulgence in the addiction, I think most of the time it won't solve any of the problems. Most of the time, what I see is like those addiction issue is actually secondary. It's just that some of them have lost some control in the issue of schools, relationship with parents, that make them very helpless. Sometimes some of them even suffer from academic, difficulties. So internet or gaming and all these actually is a secondary, pastime or something that can get control through. So of course, it's still like need to deal with their, what are the major things that they have been gone through in their life, the compassionate listening. And then you cannot be their parents when you are listening to them, because you find that the relationship with the parents are a little bit tough. So you need to be a different kind of carer to them. And then they tell you a lot of things. So from then on, only you can really help them and really help the family. Yeah.
Thank you, Bijin. Thank you so much. Yeah.
Thank you, Bichin and Dr. Tan. And then in terms of what I think Dr. Koo has actually sparked off, which is actually great discussion and quite related what Sister Barbara has actually brought in, Dr. Tan. Actually, quite a number of us on this Zoom call are doing a lot of family work, family therapy. Sister Bichin, Sister Casey, myself, Sister Tang Miyan, and a few others. Yeah. So in fact, this area, which is beyond individual therapy, where we have to go beyond even couple therapy, where family therapy has to come in. I think this is an area that hopefully, some of us are working very hard in Malaysia to actually build the area of family therapy so that we can attend to the family together, the children and the parent. Yeah. So definitely, I think what we are discussing here is just a small piece, of this whole family structure situation that we are observing, as what pointed out very sadly by Dr. Koo on all the statistics. Yeah, so I'm not surprised if we can even have another Zoom call to even talk about this area itself in terms of family intervention. The last question will have to come from Brother Alex, and the rest of you, if you still have question that you really wish to ask, can you please just type it in the chat box, So together with the organizer, I will work on the question and with Dr. Tan, maybe to answer it later on, and then now we will actually, pass back to you or find a way to get back to you. Yeah, if you still have question, please type it in the chat box, for us to look at it after this. So, Brother Alex, please go ahead and ask Dr. Tan your question.
Okay, Dr. Tan, hi, I'm Alex. I'm actually trained in hypnosis, and I learned mindfulness from Dr. Pang and Sister Mian. So I would like to ask for your view on hypnosis because after I've learned both, from what my viewpoint is, I think mindfulness is more like a preventative methods, and hypnosis is more about is very similar to meditation and is more solution focused. I would like to ask if what is your view? Thank you.
Alex, in a way, you are right and you are wrong. If I take you back to how hypnosis and mindfulness, first of all, how different they are, although a lot of similarities. The main similarity between hypnosis and mindfulness is that they are both tranquilizing, they are both calming. Okay. But hypnosis relies on a skill and technique to help the individual dissociate from here, now. So we're dissociated to time. Sometimes we dissociate to the person, yeah, and sometimes we dissociate to another place. So for instance, in the past, when I practiced hypnosis, I used to use age regression hypnoanalysis, where the patient can even go back to age 6 years old, 8 years old, and an incident comes out and we deal with it. Yeah. So hypnosis is dissociation. Mindfulness is not dissociation. Mindfulness staying on the one object for attention and reflecting on it. So it's from sati is mindfulness, to sati sampanyana. Sampanyana is reflecting with clear comprehension, because the mind is so developed through so many meditations. In a clear comprehension, we understand deeper and deeper the layers of the mind. So we go deeper and deeper to the roots of the problems, right? So that is the basic difference between hypnosis and mindfulness. Now, in terms of usefulness, which is what you were referring to, nowadays, I don't know what's it like in Kuala Lumpur. Dr. Pang can inform us. In Australia, hypnosis is mainly used for a single symptom disorder. For example, if you have a fear of snakes, right? Or you had a single event trauma, so it is acute post-traumatic stress disorder, like a bank teller got robbed in the bank and was traumatized. So for single trauma incidents, yeah, hypnosis can be used very powerfully, yeah, to help the individual. But for long-term problems, yeah, many relapses of anxieties or depressions, or an underlying personality problem, then hypnosis is much less used, yeah, and much less effective. And we need the dynamic longer-term therapies. Is that all right, Russell? Alex?
Yeah. Thanks. Very insightful. Yeah.
Thank you for asking. Thank you. And you obviously can only ask such insightful, deep questions because you've had good teachers like Dr. Pang and others.
Yes. I learned a lot from both of them.
Yes, and Ian, yes. Thank you,
Thank
Alex.
you very much.
Thank you, Alex, for asking the question, and of course, thank you, Dr. Tan, for enlightening all of us with all these questions that we have actually asked you. So naturally, we have come to the end of our Zoom session, and on behalf of Buddhist Gem Fellowship, again, Dr. Tan Ling Kong, we are very, very grateful to have you as our guest speaker for today's topic. As you can see, we are running out of time, and I'm sure, more people want to ask questions. But being the chairperson here, I have to be the one keeping to the time. So we really, really thank you from the bottom of our heart for your deep sharing today. And of course, I think to the rest of the audience, yeah, to our respected Bante Kumara, brothers and sisters in the Dhamma, thank you for joining us in this Zoom discussion. And please, stay tuned and join us in the rest of the 9 interesting topics. And each month we're going to have 2 topics, and it is on Tuesday night, 8:30 to 10. And you can check out the full list from the Buddhist Jam Fellowship Facebook or website. Yeah. And I'm sure the organizer here will also continue to send you the notification of this interesting session. So with that, Dr. Tan, again, we folded palm. Thank you. Thank you, everyone, for joining this session. And we will leave this session, with new learnings or enhanced learning, and most importantly, put it into our practice, especially those of us, the Buddhist psychotherapists. So sadhu, sadhu, sadhu.